Hello, we're back again. This is Brother D and Brother Will from Simple Complex Men. Excited to be back again. And of course, we got the none other than Dr. Lewis joining us once again. We're going to be talking about a pretty popular topic, I believe,
Yes.
that a lot of people talk about. So is it sciatica? So we're going to go ahead and jump right in. We're not going to belabor this. So, Dr. Lewis, what exactly is sciatica? I guess we can start with that.
All right. So sciatica is pain that starts at the lower back and it radiates or travels from the lower back to the buttock region, down the legs to the foot. Okay. And it can be very excruciating pain, very sharp pain actually, causing weakness on either the right leg, left leg. Some cases it can be both legs. Okay. The good thing about it is that it can last up to like 4 or 5 weeks, and with the proper treatment, it can be cured. It's not something that can be lingering on and on and on. Okay, and this is one of those symptoms that you know in the health profession we have to take more of an integrative approach. We need our
Okay.
chiropractors, physical therapists, MDs. Depending on how severe it can be, then that's when the MDs need to come in play. All right. So my point is, we can't be successful at this if there's division going on in the profession.
Okay.
Yeah.
Yeah, that's so true. What are the causes typically of sciatica? Because I've had doctors, talk about it and
Yeah.
don't sit, wallet in your back pocket and don't
Exactly.
sit on it, things like that. So I've heard a lot of things. But I guess what is your thoughts on that as far as the causes?
You're actually absolutely right, and there are some causes of it. And eventually I'm going to show you all like pictures of the sciatic nerve. We want to, take a look and see what this nerve looks like. It's a very large nerve. But the most common causes of it are bone spurs,
Okay.
herniated discs, weak muscles in the lower back region for sitting for long periods of time, being overweight, certain jobs or occupation. For example, I had a patient who made a career out of doing CrossFit, so he was definitely having some lower back issues,
Yeah.
you know. Yeah. And another patient, I didn't know this. I realized I discovered this not too long ago. I didn't know that gaming could be an occupation.
Oh
Uh,
yeah, they make some good money. Six
yeah.
figures of some of the top gamers. Yeah, yeah.
Oh,
They
wow. So
yeah.
I had a patient who not only was he overweight, but he had lower back pain. He had sciatica because all he did, he was a gamer. He's a big time gamer. He's doing a lot better now because he dropped some of the weight. Um, so it's at a point now that whenever he's sitting for long periods of time, he starts feeling that lower back pain. So he has to get up and walk around or go walking through the neighborhood. But the most two common causes are bone spurs and herniated discs.
And Dr. Lewis, because just to have you expound upon sitting down for too long, because
Mm-hmm.
you work a desk job, you may get up every so often, go to the restroom, and you just may be in that mindset of let me do some moving around. But when
Right.
you're at home, you just like, it's like I'm relaxing, out, put on your movie screen, do whatever you're going to do. So how often should we get up and move around from being from a sitting position, even at
I would
home?
say between every 25 or 30 minutes.
Whoa, you heard that, binge watchers, Netflix binge watchers?
Every
Yeah.
25, 30 minutes, get them and move around. You can get one of those ergonomic chairs that has the lumbar support, has like a curve at the bottom to help take some relief off that nerve. Because sitting for long periods of time, it actually starts off like having tight hamstring muscles. When those hamstring muscles are tight, it actually alters the alignment of the lower back and the hip region. And over a period of time, that can lead to sciatica. And as Derek mentioned earlier, sitting for long periods of time on your wallet, that wallet can compress that sciatic nerve, and then that can also cause some problems. I get that all the time with my truck drivers. They have a lot going on. They have like the wear and tear on the disc on the lower back with the bone spurs.
Wow.
A long period when they driving for long periods of time, sitting on that wallet, and that can cause sharp shooting pain going down the leg.
Mm. So you should just put your wallet in your pocket there.
Either put it in your pocket or wear one of those pouches. Put it in the back pocket. No, that's a
Yeah.
no-no.
Yeah, and think about it, it's easier said than done because every time I did that, I walk out the door, go to the store, and realize I don't have my wallet with me because I'm so conditioned. We're so conditioned, so to put it in your back pocket. So, but yeah, but you have to, like you said, it's worth it,
And it makes sense.
One day I'm gonna invent a wallet that vibrates every time you put it in your back pocket.
Yeah.
As a reminder, you gotta put it on your side or something.
Yeah.
You're not really flat in the chair with that wallet. You kind of like at a tilt.
Right.
So it makes sense. So you have mentioned getting up every 25 to 30 minutes. So how long should you be up before you go back to relaxing or whatever you were doing?
It should be like in increments of 30 minutes, and also it depends on how severe that condition is. If it's pretty severe, then we may want to cut down on the time, probably 15 minutes getting up. Okay. There are some simple stretches we can do to help relieve sciatica. I'm going to show you all that later on as well, that anyone can do actually when they're sitting in their chair. But it's very common, especially as you mentioned earlier, working from home, during the pandemic, working from home, then, it's going to lead to lower back pain, long periods of sitting all the time, muscles get weak, the hamstring muscle. There's a muscle that actually crosses over the buttock region called the piriformis muscle. That's the muscle that we're actually sitting on, especially if we have our wallet in our back pocket. When that piriformis muscle gets pretty tight, it squeezes the sciatic nerve, and that's when we start having some problems.
So that's what I'm saying, like a lot of stand-up desks in offices now.
Yes.
Wow. You mentioned about the hip, far as the tightness and things that take place, because I know when I had went to my chiropractor, one of the things he saw when he examined me was the fact everything, I guess the hip flexors, all those type of things was so tight. And he was like, wow, this is so tight. I can't even, he was like, is this the highest you can push your leg back? So, and I was like, yeah, but he was like, yeah, he said, yeah, we have to open this up. Like, this is too tight,
Yeah, you just hit it dead on. There's another muscle that also gets pretty tight or shortens called the iliopsoas muscle. I don't know if your chiropractor mentioned that to you. Well, that muscle crosses over from the front portion of the hip, goes at a 45-degree angle going back to the lower back region. So when that muscle is tight for long periods of sitting, driving, you can also feel some pain at the front portion of the hip. Okay. But eventually, when that muscle gets tight, it alters the lower back region, L4 and L5. And then you start noticing pain shooting from that lower back down the leg.
Wow.
So, in my profession, I pretty much do certain techniques to work on that to pretty much help relieve the tension on that muscle as well.
We determine if we're experiencing just regular lower back pain and sciatica.
Okay, so regular lower back pain is going to be local. You're going to have like just localized pain at the lower back. It's not going to travel. So you want to ask yourself, okay, is this pain sharp? Is it like a dull aching pain? If it's a dull aching pain, then that's more muscle related. It's just a muscle spasm. So you don't have to be alarmed by that. You just like put a heating pad back there or a warm towel back there, because anything that's warm is going to help relieve the spasm. About a minimum of 15 minutes, okay? And then do some stretches for the lower back, all right? Now, if the pain travels from the lower back to the buttock region, down the back of the legs of the foot, then there's a possibility that there's some pressure on that sciatic nerve.
Okay.
Okay. So what type of are there any diagnostic type of tests or anything that could be used to determine, I guess, whether you have sciatica or not?
Yes. Actually, you can pull it. I want to show you all the MRI image of the sciatic nerve organ. Let's start off on looking at the image on the right hand side here. Okay. So you can see the discs, which are the cushions in between the bones. All right.
Okay.
So this area is our lumbar region. We got 5 of these lumbars here. Right. So the disc here looks good because you want to have on the MRI a lighter whitening or gray area. That means that the discs are well hydrated. But as you go all the way down to the lower portion of the back, you can see that the disc is bulging out, putting pressure on that nerve there, that sciatic nerve. And that is going to cause sharp shooting pain. All right. Also notice that the disc here is very dark. That means that the disc is dehydrated. You know, inside the disc, we have 80% water. Once you lose that water, then it's going to cause some problems. That disc is going to compress, slip out of place, hit that sciatic nerve, and then we're going to have issues there. Okay. The image on the left-hand side is just a cross-section of the MRI. Okay.
Okay.
If you look straight in the center, that's the disc. All right. Now, the normal view of the disc is supposed to be like a smooth border going all the way around. But if you go all the way around and you look at it here, it's bulging out, hitting that wide area right there of that cord. That's actually the nerve there. And that's a good indication that, yeah, okay, there's some sciatica radiculopathy or sciatic symptoms going on there.
Oh, wow. You mentioned about the spine and water and hydration. Are there any things that we can do to ensure that our spine is hydrated, or is that something out of our hands?
The only way to make sure is nutrition, keeping yourself hydrated.
Okay.
What's going to dehydrate the spine is daily consumptions of caffeine, because caffeine actually draws water from the spine. Smoking, tobacco, and just pretty much not drinking enough water that can dehydrate the spine as well. Okay. The last portion of the lumbar disc, the L5 disc, is more prone to have a lot of problems because that's where we carry our weight, our center of gravity. So once the disc becomes dehydrated, it's going to easily be compressed by that gravity, slip out of place, and then we'll start having some problems there.
Okay.
Yep. So I want to show y'all another view of the sciatic nerve. Just a simple image of the sciatic nerve here. And that's a very simple MRI there. It's self-explanatory. You can see here in that red area, that's a herniated disc there. Okay. There's no water at all there. It's all black, hitting the nerve. Okay, so that's where that pain is coming from, right there.
Because I hear people talking about sometimes like they had a slip disc, and I always used to be like, slip disc, like we talking about the shoulder blade, like, but understanding and saying this, I'm like, man, I don't know. A vital part of your spine, easing its way out. That's crazy.
Right.
Kind of looks like an inner tube.
Exactly. Good analogy of the disc is like a jelly donut. Okay. So when that jelly donut compresses, the stuff that's inside it, that jelly donut, the jelly, that's when it comes out. Right. Same thing with the disc. The outer portion of the disc is made up of annular fibers. Those fibers are very strong. It takes a lot of force to actually tear those fibers. Okay. But it's what's on the inside. When the cartilage and the water actually slips out, that's when it starts putting pressure on that nerve. And then we have issues there.
So what would be some type of treatments?
Like I said, we need an integration of, starting off with some chiropractic treatment. Okay. Very light chiropractic treatment. We don't want to put too much pressure on the disc, applying heavy manipulative force, because we don't want to tear the disc even more. So we want to do some decompression therapy. Okay. All right, that's a good one right there. All right, so that's called a spinal inversion table. All right. So you can find these on Amazon, Costco, any type of they're on eBay. The prices they range from like maybe 150 to 200. Okay, so the purpose of this is to actually help take gravity off the lower back when you're actually being turned upside down. When you're upside down, our own weight is going to actually stretch out the disc to help take some relief off that sciatic nerve. Okay. And you pretty much want to stay in that position for about maybe 10 minutes, about 10 minutes a day. Okay. So you're going to be sore maybe the first 1 or 2 sessions because your body is now trying to get used to it. All right. Okay. But after a while, then you'll notice some improvement there. Okay. Because we want to stretch out that disc. Okay. Now that's a portable spinal decompression device right there. You're going to lay down your back. There's a device on the side that you move. As you move that device, it's going to slowly stretch out the disc. Okay. Because you got some individuals, they feel uncomfortable being upside down. They may experience lightheadedness, feeling dizzy. Right. So they're more comfortable just laying down on their back, especially if they have issues with hypertension. They don't want to be upside down like that. Okay. So they pretty much gonna lay down on their back, move the device to the side, and that machine is gonna slowly stretch out the disc. All right. Good thing about that, it may add maybe a few inches in height. So that's a good thing.
So hey, that never hurts.
Right. So you want to just slowly stretch it out until it's at a level where you feel comfortable. And there's no set time limit, but you want to do at least about 12 sessions of that as well. All right. So those are some things that we can do without any type of invasive treatment. But if you want to do something that's more cost effective, there are some simple stretching exercises that we can do that can help relieve the sciatic pain. All right. I'm going to demonstrate something real quick. I'm sitting in my chair right now. You can see me. Okay. So if you're sitting for long periods of time and your lower back is hurting, you get up, you walk around as we mentioned before. But you can also, while you're sitting, put both your hands on the back of the legs of the chair. And you just want to lean forward just like that, okay? And hold that stretch for about 35, 40 seconds, okay? Okay. Another stretch that we can do, if we don't want to sit back down, take both your arms, put it on the cushion of the chair, keep your legs straight, just lean forward just like that. For about 35 or 40 seconds. If we do that, we can actually feel the disc or the joints on the lower portion of our spine separate a little bit. They help take some relief.
Wow.
Mm-hmm. Yep.
Okay. So that's the poor man stretch.
Exactly.
Try that.
Yeah.
Try that. Especially with my wife working from home so much now.
Right.
Definitely want to help out with that. And it sounds like that would be key for women that has given birth and had epidural shots as well. Like that may be.
Right. That is key. I had most of my patients who were pregnant, they actually got some relief from lower back pain after delivering, the baby, the child. But I treat the majority of auto accident cases. So I see a lot of people coming in with bulging discs, slip discs all the time. Some of them they're not fortunate enough to get some relief from the epidural. They may get an epidural and have relief, but it may last for a couple of weeks. And then after the 2 or 3 weeks, they have to go back for a follow-up and get another epidural, because the epidural is only going to help block the pain. Okay. There's a portion of the nerve called an epidural sac. And what the pain management doctor do is that they inject the needle into that sac to help block the pain. But once our body flushes that stuff out of our system, it's back again. Okay. So that's when we have to step in and introduce some type of decompression therapy, give them some stretching exercises that they can do at home to retrain that disc to go back to where it needs to be.
Okay. And Dr. Lewis, how frequently should someone, I guess, as far as scheduling with the chiropractor to deal with sciatica, how frequently should they schedule, or should they be going to their therapy sessions?
Oh yeah, definitely going to say therapy sessions. And good question. If they're having some very severe sciatic pain, start off like every day. And as that pain starts to subside, then we want to start cutting back on their visits. Okay. The goal is to get them to the point where they can come to us like maybe once a week, about once a week right there.
Okay. And would that be more of a maintenance at that point?
Right. So we want to start off with the intensive phase of care. Okay. And then move on to the rehabilitative phase of care, when we start incorporating some exercises, decompression therapy, the maintenance phase of care, like maybe once a week or every other week. Okay. Now if it's like if they still having ongoing pain with weakness, okay, so that's when we want to definitely look into some more advanced diagnostic imaging, especially if they have other symptoms like changes in bowel and bladder. All right. So we definitely want to refer them out to see MD about that, because there may be a mass going on that's growing, that's putting pressure on that nerve, and they probably will have to get some pretty much in-depth or invasive treatment for that.
So once they start doing treatment, how long should they typically expect to see some results from it?
It's going to take a couple of weeks. I can't predict when they're going to actually start seeing results, because there's different degrees of the symptoms there. Okay. But the average amount of time is about a couple of weeks, like maybe 4 or 5 weeks right there. Okay. And it also depends on the age. The average age range for someone with sciatica is between the ages of 18 and 35. Okay. It may be younger than that, younger than 18, because we have a lot of gamers now. We have these gamers. So
definitely,
we have gamers now. So not only that they're having and eventually later on down the road, I want to touch on this too. Not only that they're having pain, lower back pain, but they're also having some radiating pain or radiculopathy going for the neck, down the arms and the hands. They're doing this all the time. They're not getting no movement on the arms, the shoulder, the neck. So all of this begins to tighten up. And then they start having some issues right there. Okay. But the younger we are, the faster we're going to heal. Okay. Because as we get older, we lose some of the enzymes for healing. Right. All right. So once we get above the age of 35, it may take a little longer. Okay. But we also have to do our part. We got to do our homework. We got to do the stretching exercises that's recommended for us. Okay. But on the intensive phase of care, before we start doing any type of stretching, we have to, go home, ice it down real good, put some heat on it, get up and walk. We can't stay stagnant for long periods of time, or else that lower back is going to continue to lock up on us.
Gotcha. So are there any side effects with the treatments?
Any side effects of the treatments?
Yeah.
You're going to have some soreness. You're gonna have some soreness, especially when you're getting your lower back stretch, going through the decompression therapy for the first 1 or 2 sessions. Your body's gonna be sore. So I always tell my patients that when they go home and get settled at night, ice it down. Okay, it's just like working out a certain muscle group for the first time. You're going to be sore, burning pain, ice or down. Okay. But once your body become accustomed to it, then they begin to notice some improvement.
Okay.
Okay. Yep.
Sounds good. So is there anything that we can do to like complement the treatments? Because you did mention icing up after we get the treatments and consuming more water, just anything to really help alleviate that pain. Was there any other things that could complement it?
Yeah, definitely consuming more water. And this device here is also becoming more popular. You can find this on Amazon for about maybe $25. It's a portable TENS unit, TNS. Okay, and the purpose of that is to help relieve pain, muscle spasms, also get the blood flow going in the area that's injured for faster healing. Okay, so you can find it on Amazon. There's another device. Unfortunately, I don't have this right now in my office, but there are some chiropractors that have this, and this become more popular. Actually, it's called shockwave therapy. Okay.
Okay.
So, yeah, this device actually produces a shock wave that penetrates deep into that area on our spine. And it helps break up any like bone spurs, inflammation, the spasms actually causing that sciatic pain as well.
Wow.
Yeah. It's a pretty good treatment there.
So is that different? Because I know sometimes when I go, they'll put all the stick everything and
That's the TENS unit,
wires.
yeah.
Oh, that's what that. Okay,
That's the TENS unit. Yeah.
Okay,
Yeah.
okay.
So when you go to the chiropractor, what you're getting is the standard or the industrial TENS unit. But they also have portable ones that are about the same size as your smartphone. Okay. And it has 4 wires. Attach those 4 wires to the device. And of course, at the other end of those wires, you got the 4 sticky pads. Okay.
Okay.
You put those 4 sticky pads on the lower portion of your spine, anywhere where you're hurting, lower portion of your spine or your neck area. There's a timer on the inside. We can set it for like 15 minutes, 30 minutes, or you will see a letter C in there for continuous. Okay. Which I don't recommend because a lot of people, when they put on continuous, they'll fall asleep and just keep on and on and on and on. And that can cause some problems,
Yeah.
So, I always recommend either set it for 15, 30 minutes so you fall asleep and it'll shut off on its own. You have nothing to worry about. Yeah. So that's very popular right there. You can use that with the heating pad or ice to have 2 things working at the same time. But like I said, what's really becoming big now is that shockwave treatment.
Oh, that's awesome. Well, we're actually, believe it or not, we're having so much fun. It's we're actually coming up on our time, but while we still have a few minutes left, Dr. Lewis, do you have any any closing remarks or things that you want to share that you think is pertinent for us to know in reference to sciatica?
Yes. The more active we are, the more we're able to prevent this from happening. Okay. We definitely want to stay active. When it comes to working out, we definitely want to concentrate on strengthening the core muscles, the muscles that are involved around the abdominal region, doing planks, crunches. And we also want to concentrate on stretching the muscles on the lower back. Okay. And like I said earlier, keep ourselves hydrated. Definitely keep ourselves hydrated.
Good.
Yeah.
Awesome. Well, did you have anything left, Brother Will? Any questions you have for Dr. Lewis before we let him go back to his family?
I have all the time in the world.
That's the beauty of video. I can always go back and look at it.
Wonderful.
Thank you so much. Appreciate it, brother, as always.
Yes, anytime. Definitely look into those inversion devices and those portable decompression devices. eBay, you can definitely find some good deals, put a bid on it, and it would definitely help you out as well.
Okay.
Wonderful. Well, thank you for coming again, Dr. Lewis, always blessing us with your knowledge and wisdom concerning chiropractic care, but just on many different subjects as well in terms of health, nutrition. So we're definitely excited. I know people are really receiving and being blessed.
Yes.
We look forward, definitely to having you again next month. And so we can talk, on various topics and really hopefully encourage some people and point some people in the right direction. So if you all are being blessed, please like, subscribe, share, so that your friends, family, can be blessed by this information. We're really trying to help people and make sure that they're in the best health possible, because as the Bible says, he tells us to be ye in good health, so that's important. We are, sometimes we get so spiritual, like we need a body to function and to carry out our purpose. So God wants us to focus on that as well, and not just the spiritual aspects of it. So again, thank you. I'm Dee with a Simple Complex Men, and we'll see you on the next episode.
You all be blessed.